আসসালামু আলাইকুম। আমার নাম পারবিন আক্তার। আমি বাংলাদেশ থেকে আসছি। আমার সমস্যা হতো আমি হাঁটতে পারতাম না, কোনো কাজ করতে পারতাম না। আমি কিছু দল আমার হাত থেকে পড়ে যেত। ব্যাঙ্গালোরে এসে মজুমদার হসপিটাল কুলদীপ শেট্টি অপারেশন করে আমি এখন সব কিছু করতে পারি, খুব ভালো আছি।
আসসালামু আলাইকুম। আমি পারবিন আক্তারের মেয়ে। আমার আম্মু আগে অনেক বেশি অসুস্থ ছিল, পুরা শরীর কাঁপতো। এখন আলহামদুলিল্লাহ অনেক ভালো আছে। আমরা বাংলাদেশ থেকে এসেছি। আমার আম্মু পার্কিনসন ডিসিএস রোগে আক্রান্ত। এখন পুরা শরীর কোনো রোগ নেই, সামান্য এখন আগের থেকে অনেক ভালো আছে বলতে গেলে। পুরা শরীর আগে কাঁপতো বেশি, এখন আলহামদুলিল্লাহ অনেক ভালো আছে। ডক্টর কুলদীপ শেট্টি এবং তার টিম অনেক ভালো চিকিৎসা দেয় আমার আম্মুকে। আমরা 15 দিন মজুমদার হসপিটালের মধ্যে ছিলাম। এখন আলহামদুলিল্লাহ আমার আম্মু অনেক ভালো আছে।
Hi, I am Dr. Kuldeep Shetty and I am a neurologist as well as a movement disorder specialist. My specific interests are deep brain stimulation for movement disorders like Parkinson's disease, dystonia, and also I am interested in botulinum toxin procedures for movement disorders. So here we had this patient, Mrs. Parvin ji. So she actually got this disease at a very young age. She got it at around 30 years of age. So she was suffering from this disease for the last 10 years before she met us for the first time. So she met us at the age of 40 when she had suffered this disease for 10 years. At the time when we saw her the first time, she was already in advanced Parkinsonian state. She was having very disabling movement disorder involving especially her legs. She was getting the levodopa induced involuntary movements, which is a very disabling symptom, and actually it was more disabling to her than the disease itself. So she was actually facing a lot of trouble because of the disease as well as the drug induced movement disorders. Actually when she came to us, she was totally unaware. She as well as her family were totally unaware of the point that there exists some surgical treatment for Parkinson's disease. So in the OPD I had to explain them for the first time that this is not the end of treatment for Parkinson's disease, which they were thinking. And I told them that we have surgical treatment for this disease in which we could make a meaningful difference to their life. And it was their faith in our system that I think right at the first explanation, within a couple of days being told about such a procedure, they took a decision to undergo the surgery. And so then we planned them for the deep brain stimulation of subthalamic nucleus, which is the standard procedure for such patients. She tolerated the procedure very well, and she showed very beautiful response to this procedure. And literally 2 weeks after the surgery, she was relieved of almost all her disabling symptoms. That is, she didn't have any fluctuating symptoms, she didn't have any dyskinesias. Almost 2 weeks within the surgery. So this was one of the best recoveries we had noted. And we could cut down her medications very significantly, more than 50%. And she almost was not willing to come for follow-up because she was doing so well. So she was not even motivated to come for an annual follow-up, and we got her only after 1.5 years now. And now also she is doing fine. She doesn't actually have any complaint. She came for a routine follow-up now. So literally she has been doing very well post this procedure, and she is very contented, which you know on seeing her face now. And so I would suggest the patients of Parkinson's disease that they should have a detailed discussion about this procedure with their treating movement disorder specialists. The indications of this procedure is very clear. There is no doubt. So a patient needs to be assessed from the angle of surgical fitness and whether this patient will need this surgery or not. depending on certain protocols, and the doctor should be able to tell what exactly you can expect from this surgery. Some patients may be very good candidates, some patients may be an average candidate, and some patient may be not a very suitable candidate. So this stratification is important before taking patients for this procedure, and also it will help the patient to understand how much to expect. Thank you.